Assalamu alaikum warahmatullahi wabarakatuh. Welcome to our channel. I'm 70. We talk about cell deaths and morphological hallmark of cell deaths are loss of nucleus. There are three steps when the nucleus is lost. Biokinesis. First step are shrinkage of the nucleus. Then chirohexis are breakdown of the nucleus in big spaces, and third are karyolysis, big nuclear pieces broken down to the molecular building blocks. Okay, first step are biokinesis. Biokinesis are when the shrinkage of the nuclear become shrink. Is this picture? Okay, DNA condenses into shrinkage basophilic mass. And the second step are karyohexis, when the nuclear fragmentation. Kinetic nuclear membrane rupture and nucleus undergo fragmentation. And third picture are when the nucleus and fragmented or broken down in molecular building blocks. Small building blocks. Okay, chromatin dissociation due to action DNAs and RNAs. Nuclear and occurs in the nuclear dissolution and nuclear necrotic cell. Okay. Cancer necrosis occur as result of acute inflammation to large group of the cell and is always pathologic. Types of necrosis are coagulative necrosis, perfective necrosis, membranous necrosis divided by dry and wet, caseous necrosis, fat necrosis, and fibrinoid necrosis. Coagulative necrosis are cell and organ structure is preserved by coagulation of cellular protein, characterized by ischemia impression of any organ except the brain. Coagulation necrosis are the ischemia impression occurs in all organs except only the brain. Okay, this picture and coagulative necrosis for glomerulus. The left is the normal glomerulus and left is coagulative necrosis and organized structure preserved. This picture is glomerular necrosis normal, and the left are loss of the nucleus with pale wedge shaped. Area of infected tissue are blocked blood vessel. Okay, when red infection occur, when blood enters loosely organized tissue, example for ischemia of testes, lungs, is red infection or type of coagulation necrosis. Liquefactive necrosis. Necrosis in which enzymatic lysis of cell and protein in result liquefaction, characterized by the brain, like microglial cells destroy the tissue, abscess, neutrophils containing hydrolytic enzymes that destroy the tissue, pancreatitis, pancreatic enzyme digest the pancreas liquefy. Half a surrounding fat will have fat necrosis. Cancrenous necrosis, coagulative necrosis are assembled mummified tissue trigangrena. If infection occurs on trigangrena, liquefaction necrosis occurs called with gangrena, characterized by ischemia of lower limb and GI tract. Okay, caseous necrosis is a soft, febrile, variable necrosis with cottage-like appearance. Liquefaction necrosis with dermis thickness soft to make it cheese-like, characterized by granulomatosis inflammation, TB or fungal infection, fungal cell wall, microbacterial thickness, and so. And this picture are caseous necrosis are cottage shaped and cottage cheese appearance. And then fat necrosis. Necrotic fat with jalk white appearance due to deposition of calcium. When fat cell die to trauma or when fat is broken down by lipase. Fat acids are released in presence of calcium. Saponification occurs when kept in jalk white appearance. Calcium accumulation happens by dystrophic calcification, characterized by trauma to fat. Some occur in accident trauma in the breast, pancreatic mediated damage to the pancreatic fat. Fat necrotic around the pancreas. This is a white-like appearance in the fat. Okay, fibrinoid necrosis. Necrotic damage to the blood vessels, protein is leaked into the vessel wall, which results in brain bright pink stain of the vessel wall, characterized by malignant hypertension and vasculitis. Preeclampsia can cause fibrinoid necrosis of placenta. Benign hypertension is chronic low increased blood pressure that causes slow damage. Malignant hypertension is a sudden super-elevated blood pressure that is medical emergency, finding such as PDH, renal failure, double edema. Super high blood pressure in malignant hypertension can affect wall cells. Mechanism by which calcium can deposit in human tissue there are two: dystrophic calcification and metastatic calcification. Dystrophic calcification mechanism which calcium deposit in the human body, abnormal as calcium is not supposed to just randomly accumulate. Mechanism where is dead tissue, calcium can accumulate even in serum calcium normal, in bad necrosis, in tumor as center the tumor might not get enough blood supply and die. Metastatic calcification, serum calcium and partial blood oxygen sulfate. And sulfate step can force calcium to accumulate in tissue does not mean that has metastatic cancer. Patient has metastatic cancer. Apoptosis. Explain apoptosis means falling of leaf. It is purposeful, energy-dependent, killing a small group of cells. Example: endometrial shearing during menstruation, removal of cell in embryogenesis, CDS, cell-mediated killing viral infection cells. Mechanism of apoptosis: cell shrinkage and become eosinophilic due to concentration of cytoplasma, and nucleus also shrinks as fragmentation. Apoptosis varies fall from cell like leaves fall from tree, then they are eaten by macrophage, no inflammation occur. This picture are apoptotic cells in surrounding neighbors. What is biochemical pathway leading to apoptosis? Caspase activities in the key steps. Caspase activities in proteins to break down cytoskeleton. Also caspase activities in the nucleus to break down nucleus. Three pathways lead to caspase activation: intrinsic pathway, extrinsic pathway, and cytotoxic. And if we start the intrinsic mitochondrial pathway, BCL2 is a protein whose function is to establish mitochondrial membrane so that cytochrome C from mitochondria can't leak out. Due to membrane damage, DNA damage, and cellular injury, or decreased hormonal stimulation of cell endometrial cells in the lack of estrogen, BCL2 can be inactivated. Leakage of cytochrome C will then activate caspase. Extrinsic receptor, an example: fast leak can bind into the fast release receptor CD95 on the target cell, and target cell dies via activation of caspase. Case report in CD8 plus T cells from bone marrow and positive selection. If they combine to self-antigen on MHC1 molecule, they could to life. And negative selection, if they bind to self-antigen MHC1 molecule, very strongly they die in Alzheimer's. By killing these young T cells in negative selection happens by binding fast ligand to fast release receptor on T cells. As example, tumor necrotic factor binds to the tumor necrotic factor receptor on target cell and cell dies. And third pathway are cytotoxic CD8 plus T cell pathway. When CD8 plus cells recognize foreign antigen on MHC1 receptor, they release prophorines that make holes on target cell. Then they release an enzyme that enter target cell and activate caspase. Thank you for your attention.